Welcome to Adapting Place. This is 10 questions on bioterrorism. I think if you don't know it, you should watch this video. It's very important. Things that shows up in your NCLEX regarding to bioterrorism category A information. So let's stick to it. Most of the information will be prioritization because that's the key aspect with the management, with the community health, nursing care for patients with the bioterrorism. That's what you do. Immediate care, prioritization. After a food displaces family to a community shelter, which individual should the next prioritize? Be sharp, okay? 48 hours, diabetic patient, no insulin. Child with mild fever, runny nose. Pregnant patient, swollen feet and fatigue. Elderly individual, dizziness, but alert. You got to be sharp. It's elderly, it's dizzy, but it's awake. Pregnant lady, his leg is swollen and fatigue. Expected. Runny nose and fever, probably flu. Diabetic, you have no insulin for 48 hours, you develop DKA. That's not good. Prioritization 101. In a community clinic overwhelmed by a flu outbreak, which client should the nurse prioritize? Everybody have flu. Whoever is the sickest is the one. Dehydration is the key. 50-year, 30-year-old body aches, fever, and mild congestion. Flu. 70-year-old now had fever from the flu, is confused and productive, is in shock. Or sepsis. A 5-year-old with a sore throat and runny nose is a flu. 40-year-old history of asthma, mild wheezing. You expect wheezing in asthma. This patient confused is septic. Following a tornado, community health nurse are setting up a triage station. Which individual should the nurse assess first? Pregnant woman in a third trimester with mild abdominal cramp. Okay, that's expected. A child with small laceration on the forehead and controlled bleeding. Bleeding is controlled. An elderly patient reporting chest pain, shortness of breath is not good. Airway problem. A middle-aged adult with a sprained ankle. Good luck with that. That's the right answer. Which client requires the most immediate attention? You got to be sharp. After a radiation exposure event, several clients arrive in the emergency room who need to be seen first. Patient with nausea, vomiting 30 minutes after exposure, radiation exposure, burn and blisters on the hand and forearm, radiation exposure. Patient with headache, bad. Confusion, bad. Severe hypotension, bad. They're getting bad systemic manifestation of the radiation. Fatigue and mild erythema of the chest is fine. C is your right answer. Which client should the nurse prioritize for treatment? A plane crash has resulted in multiple burn victims. Everybody is burned. Who is in trouble? The one with airway issue. Client with full thickness burn over 80% of the body. You are dead. You are black. A client with partial thickness burn to the face. Airway problem, the face. Client with full thickness burn to the arm and leg. Your leg and your arms will leave. A client with partial thickness burn to both legs and severe. Both will leave. Your airway is a problem. Face. The patient is diagnosed with smallpox after a suspected bioterrorism event. Which isolation precaution should the nurse implement? Standard precaution, contact precaution, airborne contact precaution, droplet and standard. Smallpox is at least airborne in addition to contact. Which bioterrorism agent should the nurse suspect? A nurse is assessing a patient with suspected exposure to what? Bioterrorism agent. The client report what? Double vision, difficult swallowing, and weakness in the arm. Test taking strategy. All of this is neurological. Which of these organisms causes neurological problem? Botulism. Ricin and serine doesn't cause any problem. Anthrax usually cutaneous, lung problem, and GI problem. There's three types of anthrax: cutaneous anthrax, pulmonary anthrax, and GI anthrax. Botulism is the problem. And this is assisting with decontamination following exposure to bioterrorism agent. Which action is the most important? This question, if you don't look at it carefully, you get it wrong. Key aspect is decontamination. If you do contaminate a patient, answer choice should be related with decontamination. Antibiotic administration has nothing to do with decontamination. Placing the patient in negative pressure isolation has nothing to do with decontamination. Remove the client cloth, wash the skin with soap and water, that's decontamination. Alcohol are never used for decontamination. Soap and water is the key. This is a test taking strategy. And this is assessing several clients in the clinic. Which symptoms is most suspicious of exposure to a bioterrorism agent? You're usually going to have systemic manifestation, skin infection, and other things. Severe abdominal pain and vomiting and diarrhea is not specific. Fatigue, headache, nasal congestion sound like flu. Sore throat, cough, generalized malaise is not specific. High fever, malaise, vascular rash, starting on the face to the extremities, it look like exposure. A nurse in the emergency department is notified of a possible bioterrorism attack involving anthrax. Which action should the nurse take first? Patient has been exposed with anthrax. What would you do first? Give the patient medication, notify the local healthcare providers, isolate the patient in a respiratory with respiratory status, or wear PPE. I've told you always isolation and protecting a mass number of people. But before you do anything, you don some PPE to protect yourself. This is the end of it. Thank you for watching. Take care of yourself. There's a series regarding this. If you want more, join our membership. Take care and good luck. If you want to learn more, subscribe to Adapt NCLEX and share it with your friends. Community health and nursing. Bye-bye.